Hello, my name is Chris Hansen, and this is my mammal heart dissection. So, how the heart works is the right atrium is filled up by the superior and inferior vena cava. So, we have the right atrium here. This would be the superior vena cava. Blood comes in these. And the inferior vena cava would be down here. I'm not sure if I just did a bad job cutting or if it got smushed, maybe. All right. So the left atrium is filled by the pulmonary veins. So the left atrium's up here, and it'd be filled in through the pulmonary veins, which would be these. Again, kind of squished, I think. Comes in here. See? Straight through. So the atrium squeezes the blood down into the left and right ventricles. So the blood comes in through here and here. The top portion of the atrium squeezes and pushes the blood down and through the uh, tricuspid valve on this side and through the bicuspid valve on this side. And then you have blood in the lower ventricles. I think I cut right through them here. You can kind of see a little bit better. Okay. So the ventricles compress then and push the blood in the right ventricle through the pulmonary valve. So right ventricle comes down and goes up and through the pulmonary valve into the pulmonary veins. So I think that's on this side. Goes up and through the pulmonary artery, which should be this. Okay. And that goes into your lungs to pick up oxygen for your blood. So the blood in the left um, atrium and then ventricle gets pushed up through the aortic valve. So again, I think we kind of have to look here. I kind of cut them. So it goes aortic valve. And then that goes up through, let's see here, into the aorta. And the aorta is your body's largest artery, and that goes to, um, well, all over your body, really. You can also see coming down from the aortas are, uh, so the aorta here. Kind of hard to see on this one, but there should be a right and a left coronary artery that come over here and here. So this part of the aorta right here is called the brachiocephalic trunk. What else? Ah, so I kind of cut through them again. So if we take this off, so these are connected to right here on these. So this is called the bottom of these right here is called the papillary muscles, and that's what can basically regulate the flow through the valves of your heart. And these things, so the muscle is connected to the valve with these, and those are called uh, cord tendinere. Um, Also, I'll point out that the trabeculae carneae, that's this kind of rough area, ridges or folds on the ventricles. Um, I guess I didn't mention right at the beginning, but the apex of the heart is the bottom, the base of the heart is the top. So we should be able to see the tricuspid valve on the right and the bicuspid valve, which I think is this right here on the left. Unfortunately, I cut my heart kind of funny, so they don't show super well. Um, Pulmonary veins. Seeing if I'm missing anything. Ah, one last thing. This kind of thick wall that comes down the middle, that is the brachiocephalic trunk. Scratch that. It's the enteroventricular septum. That's what separates the left and the right halves of the heart. Thank you.